Hi everyone, it's Lorelei. Once again, I'd like to bring the news on mental health to you from across Canada and the world. If you are new to my channel and you like the valuable information and other educational material I am providing, kindly hit the like button and subscribe to the channel. Also, if there is a particular piece of news or topic you would like to comment on, please feel free to do so. So let's get started on the most recent news for this week. Alberta Health Services pausing mental illness and addiction program referrals. It's been a hard road for Marie Lafleur and her family. Her son struggles with mental illness and addiction. His only real support right now is medication. We as a family have been through a lot. Hospitalization, police arrest, calling 24/7 lines, being punched, being verbally abused, she explained. We gave up a few times. They've tried many programs to help the young man in his 20s, but the one at Centennial Center for the Mental Health and Brain Injury in Ponoka was a game changer. It's a dual program for mental illness and addiction, Lafleur said. It was very good for him. It was the best program he had. Lafleur was relieved when she found out her son would be going back next week, but then she got a phone call saying the program is paused indefinitely. I was so appalled that I was numb, she said. For a person who is struggling with mental illness, being rejected after asking for help is extremely difficult. Lafleur was not directly told why it's paused, only that there are COVID-related concerns. She wonders why this is happening in the middle of a mental health and addiction crisis. Our son could die tomorrow if he decides to use and he meets the wrong person that sells him something. He might die, she said. Alberta Health Services said it needs staff from the facility to supplement a provincial system strained by COVID-19, so it's temporarily pausing some community referrals to the Concurrent Disorders Enhanced Services program, previously known as the Dual Diagnosis Program. Alberta Health Services told Global News the site is dealing with COVID-19 and some inpatients will be transferred to non-acute spaces. Once that is complete, we will review whether we can accommodate some community referrals. Alberta Health Services is also temporarily pausing admissions to another adult unit that provides recovery support programming for those with stabilized mental illness. If this happens, we will transition patients to a virtual model of the psychosocial rehabilitation program, Alberta Health Services said. We will work closely with patients and families to ensure they continue to get the care and support they need. Lafleur called her family's situation devastating. The hope is not there anymore, she said. It's a catastrophe for us to have the doors slammed in our face a few days before he could go into the program. She said until it comes back, they are out of options. TikTok has new mental health resources for its users. Some experts say it's a good start. The videos, which use the Suicide Prevention Month hashtag, coincided with Suicide Prevention Awareness Month, which takes place every September. The trend picked up just as TikTok announced last week that it would be implementing new resources for those who were struggling with suicidal ideations. The new tools include an in-app resource list of crisis hotlines around the world to help users in every region, information on how to engage safely with someone who may be in crisis, resources including the crisis text line helpline whenever someone searches for terms such as hashtag suicide. Some mental health experts told NBC News the added resources are a step in the right direction, while others believe links and disclaimers can only go so far in helping people. Regardless, the consensus among those interviewed is that the decision to make such changes to the app signals a positive shift in how social media platforms are handling the mental health of their users, particularly those who are younger. Social media platforms have become a space for our kids and marginalized adolescents to really express themselves, to identify and relate to one another, said Phyllis Alonge, the former clinical director for the Society for the Prevention of Teen Suicide, who now works in private practice. And we don't want it to be unbalanced. We want to minimize risk and maximize resources. The psychological experience of taking off our masks. The recent CDC announcement that fully vaccinated individuals no longer need to wear masks was met with a mixture of emotional responses. While a step toward normalcy is, overall, a joyous occasion, many people are now feeling confused, anxious, and asking themselves, am I ready for full-face socializing? It's safe to say we've all been dreaming of the day we can step into a maskless future, but the thought of discarding them for good has thrown some individuals for a psychological loop. In many social scenarios, masks have become a rule of engagement during the pandemic. Leaving home without one can keep you from entering stores, restaurants, and public transportation, and has sparked controversy across the country since the pandemic's beginning. So if you're feeling anxious about removing your mask, keep in mind that this is only normal. While the transition back to a naked face won't necessarily be an easy one, we're all allowed a period of adjustment as we get used to maskless life. Social media and mental health, depression and psychological effects. Social media use can lead to low quality sleep and harm mental health. It has associations with depression, anxiety, and low self-esteem. Many people in today's world live with their smartphones as virtual companions. These devices use electronic social media networks that alert users to updates on friends, favorite celebrities, and global events. Social media has become firmly integrated into a lot of people's daily lives. According to the Pew Research Center, 72% of people in the United States now use social media. At its core, social media is a powerful communication tool that has changed how individuals interact with one another. It speeds up how people exchange and share information, thoughts, and ideas across virtual networks. However, social media does have downsides. Some evidence suggests that its use, in particular, its overuse, can negatively affect mental health in numerous ways. Social media has associations with depression, anxiety, and feelings of isolation, particularly among heavy users. A 2015 Common Sense survey found that teenagers may spend as much as 9 hours of each day online. Many of these individuals are themselves concerned that they spend too much time browsing social networks. This wave of concern suggests that social media could affect the mental health of its users. The researchers behind a 2017 Canadian study confirmed this finding. They noted that students who use social media for more than 2 hours daily are considerably more likely to rate their mental health as fair or poor than occasional users. One of the downsides of social media platforms is that they give individuals the opportunity to start or spread harmful rumors and use abusive words that can leave people with lasting emotional scars. National surveys and population-based studies show that the world of social media can have devastating effects on users' mental health. In the US alone, survey findings show a 25% increase in suicide attempts among teenagers between 2009 and 2017. A 2019 study Trusted Source suggested that teenagers who use social media for more than 3 hours daily are more likely to experience mental health problems, such as depression, anxiety, aggression, and antisocial behavior. Additionally, social media can facilitate cyberbullying and create unhealthy self-centeredness and distance from friends and family. Thank you so much for watching this most recent update on news for this week. And again, if you liked what you heard, kindly hit the like button and subscribe to my channel. Till next time, take care, and I'll see you soon.